The decade of the brain was the 1990s, and that's where neurology went from a diagnostic to a therapeutic specialty. The adage when I was in my early training for neurology was diagnose and adios. The decade of the 2000s was of hope. The decade of the 2010s was a little frustrating, but over the last year or two, delving into different aspects, more of a instead of a lumping of patients as it's all one disease, a splitting of patients, looking at the genetics, looking at other traumatic issues. And so I have gotten more into, I think I can actually prevent or prolong or even reduce the severity of some of our elder care diseases. And that's what I've really focused on. I love prevention. Maybe it's I'm lazy. I'd rather prevent than treat. So we're not just locking a person away. We're dealing with that. Sometimes these are red flags that something else is happening. Urinary tract infections, pneumonia, just the plain old flu can have very serious consequences. And so when one sees real fluctuations, we're looking for other aspects medically to see what would cause this change in the dementia patient. But I lived through the era where when you had a stroke, they put you in a corner and that was it. And to see the evolution of stroke care over the last 15 years with the advances in medicine, clotbuster drugs, clot removal strategies, stroke mortality going from number 3 to number 5, things can change.